Hello, my name is Laura Travis, and this is my integrative review for synthesizing evidence. My integrative review starts with a PICO question, which is in the intensive care unit, how does rotating antibiotics compared with an unrestricted antibiotic prescription affect the likelihood of contracting an antibiotic-resistant bacteria within a 12-month period? The importance of this problem is that antibiotics are one of the most prescribed class of drugs among healthcare providers. And the discovery of penicillin in 1928 changed the world in how we practice medicine. However, it wasn't long after that we discovered antibiotic-resistant bacteria. And it's become a grave problem in the United States with more than 2 million estimated illnesses and 23,000 deaths annually. The CDC says that the use of antibiotics is the most important factor in the development of resistance. Essentially, the antibiotics kill off the good bacteria, and then the resistant bacteria are able to thrive. While antibiotics can treat bacterial infections and even save lives, it's estimated up to 50% of the time they are not being optimally prescribed. The theoretical framework for this integrative review is the germ theory and principles of infection founded by Louis Pasteur in 1858, which essentially says that pathogenic microorganisms are the cause of infectious disease within the body. According to our text, this theoretical process initiates the search for the causative agent of infection and methods of transmission. Once this has been accomplished, the focus can shift to the development of ways to prevent and treat the disease. The research process. First, I searched the EKU online database, and 3 studies were chosen to include in this review. A total of 15 results were populated, and 3 studies were chosen. These studies had inclusion criteria of antibiotic resistance, antibiotic rotation as a method of study, and the setting is an ICU. In study 1, it was a cluster randomized crossover design in which 8 ICUs were studied. Study 2 is a 16-month study with antibiotic cycling in 4-month increments. And study 3 is a 12-month study that involves monthly rotation of gentamicin, ceftazidime, and piperacillin tazobactam. During all of the studies, respiratory aspirates and nasopharyngeal swabs were taken and selected and tested for antibiotic-resistant bacteria. Synthesis of the research findings. Each of these studies included antibiotic rotation strategies in the hopes of decreasing the rate of gram-negative bacteria. All of these studies took place between a 12 to 18-month period, and the biggest difference was the way in which they rotated the antibiotics and which antibiotics they used. They were all very strong studies. They were very clear and good data collection and categorization of results. They had large sample sizes, and they were practical and able to be adopted to standard practice if they did prove positive results. One weakness identified among all of the studies was a short period of time that they were studied. I believe that a longer period of time may prove more beneficial for the study. The specific nature of these study methods leaves gaps in the literature that need to be examined. Each of the studies performs a very unique intervention, leaving other possibilities or combinations of antibiotic rotation strategies uninvestigated. At this time, it is not recommended that antibiotic rotation be used in practice because it has not shown to have positive results. But it is possible that the right strategy of antibiotic rotation has not been discovered yet. Right now, for nurse practitioners, we cannot put this into practice yet, but I think it's important that nurse practitioners continue to search out these studies, as antibiotic rotation may be proved effective if the best method is discovered. For evidence-based practice, again, it is not recommended that antibiotic rotation be used in general practice, but more studies are being done, and APRN should make a habit of checking the research to see if any new studies regarding antibiotic rotation have been completed. That's it. Thank you.